Hey guys, Dr. Dobson. We're going to be going over an endo case in this video. This is a patient that came in with a chief complaint of pain on their upper right when they bit down. X-ray showed that the 1.6 had a very large periapical lesion, and the bite wing showed that there was decay between the 1.6 and the 1.5. This 1.6 probably was not necrotic from the decay on the mesial aspect, but when the crown was done. The 1.5, it maybe had a bit of a presentation of having a lesion. Difficult to say though. It did test negative to EPT or to cold, so we decided to do root canal and crown on that tooth as well. So the video is going to be 1.5/1.6 root canal, 1.5/1.6 crowns. So here's some progress footage. We found 4 canals in the 1.6 and 2 canals in the 1.5. We obturated and finished up. There is the final little cement that we would have picked out at the end. The preps, we did a large gingivectomy to get access to the margins and the final crowns there. So here's some footage. They had gold crowns. Oh, let me just put this back. So some footage, they both had beautiful gold crowns on them that had to come off. So we sectioned the crowns, accessed the canals, instrument, obturate, core buildup, and then prep. So there's the final. And we'll start from the beginning here. There isn't going to be, I'm not going to be fast forwarding because it's pretty heavily trimmed and edited. So if you like this kind of format, then let me know. If you prefer the fast forwarding and kind of seeing everything, but just at different speeds, then let me know as well. So to section the crowns, we're going to basically just make a trough in the buccal and occlusal surfaces of them. Just large enough to get our crown separator in. We'll take the separator and just apply some force until we can see movement. And once we can see movement, then we will apply some vertical traction force with a spoon elevator, or a spoon. So we're going to take the spoon and remove the crowns. And then we will start doing our access. And we're going to do full coverage crowns for both of these teeth. We'll do a little bit of occlusal reduction with a wheel. There was a pin in the 5, which I'm never really a huge fan of, and some core material. So that's going to spark. And we'll do the same on the 6, just doing the occlusal reduction so that we get as close to the pulp chamber as we can. And then we'll do our access, our pulp chamber access with a KS1 burr, opening it up on the 6 and on the 5. And then we'll go in with a Muntz Discovery burr and just remove some dentin where we suspect the orifices to be located. There's a intraoral photo there. Both teeth were non-vital, of course. And once we have our orifices discovered, or at least one in the 5 and at least 3 in the 6, we'll get a rubber dam on and isolate the teeth. And then we will poke around and find 2 canals in the 5 and 4 canals in the 6. These days I would take a CT of a situation like this to see exactly what we are up against before we operate. And then once we have files down all of our canals, we'll do MB2 discovery, and we're just going to poke around and find a stick pretty well palatal to the MB1. So we'll get a fine hand file down that canal until we have a apex reading on our apex locator, and then we'll open them all up to an F3, which is a 3504. So doing our glide path, this is a 2504, sorry, 1504, and then the 2504, and this is a 3504. And then we'll irrigate between files and then use an endo activator at the end. We're going to put in 4 cones and get a trial cone x-ray. And we can see that we're at length on all the canals, except we're way long on the palatal. So and that is pretty deep down there. So we'll size up the palatal cone and then dry and obturate. And then we will put our bioceramic sealer into each of the canals before putting our final obturation cones in. And that's it for the root canal. So we'll sear off the cones and then remove some of the excess GP. Not necessary to take it all the way down to the pulp floor, but there's the final. Unfortunately, I turned off the camera I forgot to turn it back on for the preparation, so that won't be included, but we'll just put some core buildup material in the access chambers, and then that will be it for the footage for this video. This is Aqua Forte, 5-second etch, rinse, apply the material, and then pack it in with a moist cotton pellet, leave it for 5 minutes, and then they will be good to go.
Take the dam off for Andrew here.
And that's going to be it for that one. There was the final. After cementation, there was a little piece of cement, obviously, that there was left to clean up, and the final's there.